Welcome. Delighted that we're going to have a session today focusing on the future of the care workforce here as part of the Professional Care Workers Week. So very important discussion, very important theme. And my name is Vic Rayner. I'm the Chief Exec of the National Care Forum, and I'm delighted to be chairing this event and to have such an esteemed panel that I will introduce shortly. But before we start, I just wanted to acknowledge the very sad passing of the Queen and joining our voice to many other who are sharing their condolences with the royal family and recognising and remembering the fantastic contribution she made to all of society, but particularly the very important role she played within the care sector, including her patronage of many care organisations, but also the hugely important respect and recognition of care that she showed in many of her addresses and in her ways of acting and regard for the care sector. So very sadly mourned and very sadly missed. So I wanted to just acknowledge that as before we started. So I have four panelists here for you today who are going to help me in this discussion to focus on the future of the care workforce. It's very difficult to have that discussion without starting and acknowledging a starting point, which is one of very significant crisis and challenge across the whole of the care sector. We're faced with a situation where we have over 165,000 vacancies within the care sector as the last sort of cut of that from Skills for Care, the sector skills body. But alongside that, we also know that those vacancy levels are continuing to rise. There's geographical differences of that across the country, but also in relation to particular roles, and some roles which have never really had been as problematic before, such as senior care worker, for example. The percentages of vacancy rates in those roles are becoming very alarming alongside nurses and alongside home care workers. So a very challenging recruitment environment that we're in, but we also know retention is very difficult. And at the last Skills for Care report, I think for the first time as a sector, we were looking at not only the vacancy level increasing exponentially, but also the number of roles filled within the sector shrinking for the first time. And we know this is all against a demographic trend and all sorts of indicators which show that the need for a care workforce will only grow in the coming years and decades ahead. So with that in mind, I'm going to come first of all to this panel just to ask them what they think the future of the care workforce is. Just a couple of minutes from each of them, and then out of that we're going to draw together some themes and items for discussion. We've got up to an hour for this discussion, and we'll see how we go. I like to talk, and I know many of my colleagues here around the table share the passion for the workforce and share the passion for solutions and the future. So I'm very hopeful we'll have an extremely interesting and vibrant debate. So George, I'm going to come to you first. If you don't mind introducing yourself as well, and then just give us a couple of minutes on what your thoughts are on the future of the care workforce.
Thanks very much, Vic, and pleasure to be here. My name's George Appleton. I'm the head of policy at Care England, a representative body for independent care providers. I think broadly, to expound what Vic's already said, there is an increasing demand for care, whilst the workforce, both those providing formal care in care settings and those family carers, is likely going to struggle to keep pace. And unfortunately, we are operating against the backdrop of the likes of poor pay, employment conditions within social care, which have consistently affected the size and structure of the workforce, and against the sort of further picture or backdrop of underfunding and a growing demand for care services. Addressing these issues is becoming increasingly challenging, hence the sort of pertinence of this particular workshop and webinar. Broadly, the adult social care workforce, in terms of its size, is estimated at around 1.54 million people, rivaling that of the NHS. And as Vic's already mentioned, vacancies have increased by 52% over the last 12 months and now totaling 165,000, which is very much a reflection of the severity of the current recruitment and retention pressures. To sort of pick out 3 themes, Vic, in the interest of keeping this concise and brief, I suppose, from Care England's perspective, one of the key points is around uncertainty around whether the demand for care services can indeed be met. So demand is being driven by the increasing number of people over the age of 65, in turn driving up the total number of people with a physical disability and other vulnerable people who are more likely going to need a social care service. And as a result of changes in both epidemiology and demography, people are getting older with complex conditions, and the demand for different types of social care services is only going to increase. So we've already seen, for example, an increase in the likes of home care provision and supported living services, but that's not to say there will likely remain a huge demand for residential care services with or without nursing, as people will likely continue to need to be supported within these specialist settings. But the workforce needs to be able to change and shift appropriately to be able to meet this demand from both a supply perspective and be adequately trained and supported to be able to meet the needs of these individuals. So the second key area I would suggest is around the gaps within the workforce. So I'm sure it will come as no shock that the supply of available workers is substantially lower than the demand. And I think broadly, I'm not sure whether any new projections have come out, but the number of social care jobs will need to increase by around 29% to 2.16 million jobs by 2035 to keep pace with this growing demand for care services. And an interesting nuance, and the sort of third point I wanted to come to, is around the specific demography of the adult social care workforce, namely the fact that we do have an aging workforce. So the adult social care workforce itself is aging. Based upon Skills for Care data, 27% of the care workers within our sector were age 55 and over, compared to 20% of the economically active population. So this works at around 410,000 jobs in adult social care, and therefore from a workforce planning perspective, those workers are more likely going to retire within the next 10 years. So it's about appropriately managing these individuals' exit from the workforce, being able to appropriately retain these individuals for a longer period of time, but being able to sort of increase the attractiveness of the adult social care workforce as a career opportunity for those younger individuals at a sort of younger age. Those are the 3 points I wanted to start with, Vic. Happy to come back to any of those points and expand them further, but I'll pass back to you.
Great, thanks very much, George, and huge, lots of very interesting things in there that I suspect we will come back to, and you know, they're all leading in quite a worrying direction. So let's see what Jane's got to say to see whether she's going to offer reassurance or more concerns on the horizon. So Jane, again, would you mind introducing yourself and then give us just a couple of minutes on your thoughts on the future of the care workforce?
Thank you, Vic. Yes, I'm Jane Townson, Chief Executive of the Homecare Association. We represent and support providers of care in people's own homes across the UK. So I don't want to repeat what George has very eloquently summarised, because I think he paints the sort of overarching picture of where we currently are. And I don't want to indulge in lots of hand-wringing about how awful it all is either, really, because I think I'm always thinking about the fact that in 30 years' time or so, when I get into my 80s, there are going to be twice as many of us over 85 as there are now. If we can't support the current population of over 85s with the care workers we've got, we're definitely not going to be able to when I get there. So I think we need to start thinking a bit more radically about what we might do differently. And as Vic knows, one of my little sideline interests is robotics and AI. And joking apart, I know lots of people say, oh, how terrible, care is a very personal activity, which it honestly is. But if I am faced in my 80s with the prospect of being alone at home with no help at all, or being alone at home with a robot, I'm going to take the robot because there probably won't be enough care home spaces for everybody anyway. And I would like still to be independent. And even now, you know, there are there are robotic technologies that are doing things like folding up the laundry. Now I'm going to vote for that now, not till my 80s. And I think the other area which I think is interesting is that there are other sectors that are currently competing with us for workforce. So if you think about distribution warehouses and delivery drivers and that kind of thing, we're already seeing automation and robotics developing quite quickly in some of those areas. So there are videos on YouTube of entire Amazon warehouses where all of the picking and stacking of all of the products is done robotically. So I'm thinking that maybe care could be one of the last areas where people's jobs won't get replaced. So thinking optimistically, there's a whole vast group of people that I call the pre-care people who currently don't receive care, but probably could benefit from having some technologies in their homes that enable us to see if there are any deviations from normal for those people, and then only put in interventions when something unusual happens, and working closely with our colleagues in the NHS who are becoming a lot more interested in remote health monitoring. NHS trusts all over the country are implementing so-called hospital at home services, and early data on those indicates that the outcomes for people are no different from when they have to go into being treated in hospital, and also they save money for the NHS. So I think we're going to see a shift towards more technologies being in place in people's own homes, that those that are being supported by informal carers before they even need sort of state-funded care services, but also maybe some more sophistication in the kind of technologies that are available. I mean, just as an example, if people could get out of bed themselves without having to have double-handed transfers, and there are bits of kit that enable people to do that, that could make a really big difference. So I'd like to see more research and more investment from the government in some of these other technologies that aren't just about tablets and care delivery management software, but some of the equipment and the tools and other automation in the home and in other types of industry that could enable us to use the workforce that we have got in the most efficient and effective way.
Yeah, thanks, Jane. And I think that's kind of a bit of a watchword now, probably, for when government or indeed care providers are thinking about tech. There's a double agenda, isn't there? One is about what will this do to help support and promote independence, and then the second is how will this minimize the workforce requirements in a way, and they sometimes sit as uncomfortable bedfellows in a way because of people's perception about the personal nature of care, etc., etc. But yeah, we've had lots of conversations about, in the past, I know about having toilets that will, self-cleaning toilets and things that are actually, from a dignity point of view, are probably much higher on our list than the Hoover that cleans the house for you. Although I quite like that.
Yeah, me too.
But so that's great. So we're beginning to build a bit of a picture. So we've got sort of very kind of clear perceptions from George about the growing needs in relation to the workforce and the changing demography of the workforce and how we might cope with that. Some thought about technology within that and how it might, how we need to really accelerate the kind of focus on that. Deborah, I wondered if I could bring you in here for your thoughts, but also I'm quite interested, particularly, in your role around nursing, particularly to think about those kind of the professional role, but also whether there's within that context of the future, whether we're thinking enough about global pressures around workforce too. So again, would you mind introducing yourself and giving your thoughts?
Yeah, so absolutely. So I'm Deborah Sturdy. I'm the Chief Nurse Adult Social Care based at the Department of Health and Social Care, and really pleased to be here, and we'll have lots of views. So helpful, as you say, to hear the stark realities of what we're facing, that, and we can't kind of hide from those, and really interesting about Jane's kind of offer of that kind of AI and robotics. I think that is, the stuff we don't need to do and something else can do, then absolutely hand it over. I think that for me, although it sounds like a very gloomy picture, I think that we've got to look at the positives here. And although we know what the realities are, actually it's about the solutions that matter, because that's what's going to make the difference to both attract, retain people into the sector and actually deliver the care that people need. So for me, I think we have to get the sector to be much more proactive in talking up the positives, because actually if you're consistently saying how awful it is, why would anybody want to come and work with us? So I think we have to, amongst that, put the realities out there, but then how do we address it? For me, in terms of, we need to shift from this being a second class option to a first class choice of career. I recognise the issue about remuneration, I recognise the issue about recognition, and we need to be doing more about that. But I think the opportunity from a nursing perspective, a registered nursing perspective, we are facing a massive global challenge. There are people coming into the market looking for recruitment. People like America, Australia, who've not been recruiting for a long time, are suddenly coming in. Similarly, huge exponential rise in recruitment in places like Germany, the Middle East, absolutely everywhere. So we're in a hot market. So I think we have to look at growing our own solutions to this. There's only so much that we can take from elsewhere. So I think the opportunities around, apprenticeships into nursing, looking at nurse associate placements, and actually that, again, how we support those financially, both for the individual, but for the employer, how can we increase that? And I think that we need some radical roundtable kind of thinking about what does that future workforce look like, and how can we do that differently? Because I think we can't always do what we've always done to get us where we need to be. So that, I think we're going to need a mixture of people. I think there's potential in here for a more hybrid type of worker who does some of that rehabilitation stuff, as well as that domiciliary care and that kind of health intervention. I think we've got to explore that more. I think we've got to look at different places to fish for people. I think we've got to look at, making this more attractive in it as a flexible career option, as well as flexible working terms and conditions for people. And I always think, this time of year, children are going either into secondary education or young people, little ones are going to school for the first time. And I think there's that whole workforce there. There's parents who might be starting to think about having a bit of time to do stuff that we should be, hanging around the school gates almost. But how can local communities, and I think again for the sector, how can local communities come together to be thinking about who they can attract? And I think it is community-based solutions for a lot of this as well. How can people come together and share those opportunities? I think we need to look at career pathways from novice to expert and everything along the way. And when I think of careers in social care, the image that comes to my head is almost that tube map. There are loads of destinations. There's lots of different ways of getting there. And I think we need to explain that better. And there really are those life stories of the linen assistant who becomes the care home manager, or the care assistant who becomes a CEO. And of course, that's not everybody, and we need everybody at every level, but we need to talk up those opportunities. And I think, doing that, we can give the NHS a run for the money around some of these things. I just have this question in my mind about, as we go into yet another difficult winter, if we'll see people in the NHS thinking about a career in social care. And I think we need to be promoting that and talking up the opportunity that it offers. And I know there's always that kind of stumbling block around, people talk about pensions, but I think things are changing around that, and I think people might look for different ways. And I think that kind of personal satisfaction sometimes, and actually some of the paying conditions is comparable to the NHS, not so much the pensions, but it is comparable. So how do we talk that up as well? So I just think that there are opportunities around this. We have to create opportunities. I think we have to hear, for me, authentic voices of the sector and of people working in various roles about what's good about it. I think that's Deborah, really, really important.
I'm going to stop you there, because that's all really important. And I think there's some fascinating stuff in there about about career pathways and things that we will come back to. And I particularly thank you for raising that kind of hot market, because I think you're right about America, Australia and China and other countries which are actively looking. And of course, Grow Your Own is successful as long as we can keep people, as well as attracting other people from other countries. So there's some really interesting stuff within there. Nadra, I just wanted to give you the chance to kind of come in and give your thoughts about some of these things we've talked about, perhaps, you know, around the sort of some of the issues Deborah's just raised around talking up and pathways, and particularly your experience of working with small organizations and how the workforce impact on those is different perhaps to some of the larger bodies. But again, if you can introduce yourself, that'd be very helpful.
Thank you, Vic. Yeah, Nadra Ahmed, I'm the Executive Chairman of National Care Association, and we represent small to medium-sized providers predominantly. So, I mean, it's always good when you hear colleagues speaking that we're all kind of saying the same thing, but in slightly different ways. And I think that's the important thing, that there is consensus around most tables that the workforce for social care is a critical element of our delivery to some of the most vulnerable people, and delivering it at the time they need it. This support, you know, care and support needs to be available to them at the point that they need it, not as an afterthought. So we, you know, for years I've been on these roundtables talking about the workforce, you know, and how we're going to, what might the future look like. And we have consistently, colleagues around this table, we've consistently talked about, you know, that we're heading for a crisis, I mean, it almost feels like, you know, we are there, and we're still looking at what that might look like. I think the vacancy rates have continued to grow. It doesn't matter what we say and do, it does continue to grow, and I think that's a worrying sign, which may have a lot to do with the image, the acknowledgement, the support that we give the people who might choose to take that as a profession. And so that leads me to, you know, the fact that it's not professionalized enough for us to be thinking it is a profession. People are working really, really hard, highly skilled individuals who are working in care settings. And I think in smaller homes, much more so in some ways, because it's a smaller group of staff who are doing many more things with specifically rounded responsibilities. The nature of the role of social care, I mean, I started in this sector 41 years ago. And what's really interesting is what my care assistants did in 1980 is very different to what the care assistants are doing today. And I think that needs some acknowledgement. That skills, the skills that they're looking at, you know, we didn't used to take people who were incontinent when I first opened. Of course, that isn't even a thought now. That's what you have. End of life care, stroke management, all of these things. These are quite challenging things. But actually, just, you know, focusing back on what Deborah said, and we've been in meetings together where we've talked about this before. It's a highly rewarding role. It's, you know, once you're in there, it's quite infectious to work in social care. The fact that you walk away from your work at the end of the day, you may be exhausted, but it actually is very rewarding in the kind of personal terms of making a difference in somebody's life. And we need to get those messages out much, much more as we look into the future. And how do we recruit people? The thought of hanging outside school gates, you know, is quite interesting. But, you know, we have got to start people young. You know, my grandchildren are watching me working in this sector. My children know what this sector is, but they haven't chosen to go into the sector, which is really interesting. And why is that? They've not kind of, they've seen a different, their perception is very different. We've not been able to show them the reward. And I think we've got to also, as a nation, stop relying on informal care. I think that's a government responsibility. As we go to the future, we've got to look at that, because we're relying too much on that informal care that's available. And then and that gives us that sort of get out clause that actually it's all okay. But the issue of not having enough workforce is much bigger than robots might be able to address, because there are so many people out there who are looking after loved ones, where they could do with that level of support and the impact that has on them. There are worrying tendencies around the managers. You know, that really is worrying. We've got an aging population of workforce, we've got aging population of managers, we've got burnout in managers. How do we get that management structure into place so that we can actually show them that actually this is a rewarding role, that this is something you can aspire to, and this is something you can do, and you can become the CEO of an organisation. There is a career pathway. So I think that career pathway needs to be taken into place.
Okay.
There is a growing need and a growing demand. Sorry, do you want me to stop?
I'm just
Have I gone away?
Well, I'm just thinking that we've got quite a lot of kind of key areas now, in a sense, and I think I'm just really interested in some of the see if we could kind of break it down a little bit, so that we can, you know, maybe not be having this discussion again in 5 years' time and saying a crisis is coming and we're in it, you know. So let's try and unpick a little bit of what some of the things are that you've said, and let's see, you know, we're not going to necessarily get the solution, but Deborah's talked about, you know, what I think we probably can all agree on is the urgency. So there is nothing, I mean, the figure that's quite often talked about, and I think you raised it, George, you talk about 2035. And we've talked about that as a kind of date for ever since I, you know, came 5 or 6 years ago into care. That 2035 has remained there as the sort of date that we're heading for. That's now, you know, just over 10 years away. And the number of people that we need to fill that gap is 4 times more than the number of people we can't fill on a daily basis. So the likelihood of us ever reaching that figure without doing something hugely drastic is very limited. The most drastic thing I've heard from you so far is the AI, is the robots. And so, you know, in essence, we're talking about, and perhaps the least sort of explored thing, maybe in a sense, is an understanding of how quickly that vacancy gap may grow. So George, I think you talked about 27% of people as a Skills for Care stat. Great, I could see Juliet's on the call from Skills for Care. You know, that's 27% of people who are 55 and over. So actually, within this next 10-year period, not only do we need to find another 500,000 workers and cope with 165,000 vacancies, we're talking about 27% of the workforce disappearing. So we nearly need 1 million extra people within 10 years' time to work in social care. So that's the challenge. Robots and AI, that's part of it. So can we just spend 5 minutes or so thinking about how we make that a meaningful reality and what that would look like? George.
Yeah, cheers, Vic. So I think from my perspective, it's important to look at it from a sort of, what can you do from a practical policy perspective? And that's naturally given the nature of my role. But I think when you look at the aging workforce more broadly within the economically active population over the last 20 years or so, the number of over 65s who are employed, this is not just social care, but the sort of broader economically active population, has increased by 188%. So from 455,000 to 1.31 million. So I think increasing the number of over 65s in the workplace unlocks enormous potential for employers to embrace what is a talented, flexible, highly skilled workforce. But it also requires many employers to change their current practice and reconsider how they engage with and attract talented older employees. So policy responses, for example, need to focus on empowering those older employees. For example, studies have highlighted that many older workers would remain in the labour market if the work they're currently undertaking could be more flexible. Therefore, employers potentially should look to increase work flexibility by, within a social care setting, for example, relocating social care workers who are struggling with the physical demands aspects of the work, let's say, into more relationship-based roles, for example. And research, again, generally indicates that staying in the workplace or the workforce for a few more years, and again, this is not just social care related, but the wider economically active population. So staying in the workforce for a few more years beyond the age of 65 can have a significant difference to not only someone's income, but also their physical and mental health in later life. So it's about really increasing these opportunities, Vic, from my perspective.
So all to play for in that sense. So here's a kind of strategic policy response, which is every social care employer to review their flexible working arrangements, talk to the regulator, make it easier for people to job share in senior roles, etc. There's some things that need to fall into place for that, but actually let's look at the talent. Let's look where the talent lies. If it's in that 27% who might leave, how can we make them not leave in 10 years' time, but leave in 15 years' time instead? Great, fantastic, something really tangible. Jane?
Yeah, I was going to sort of say the same thing, that I don't think we should make the assumption that people are going to retire when they say, you know, by traditional ages, because people can't afford it. But also, I think it's making, if you look at some articles in the wider press, there's quite a lot of people age 50 plus who feel that they haven't been treated all that well by their current employers, not necessarily in care, but in other parts of the economy, let's say retail or something. So quite a lot of people withdrew from the workforce during COVID and haven't gone back. We've also got a problem with the population, in the sense that there's unfortunately still a large proportion of people unable to work because of health issues that have been unresolved, because they're on waiting lists, and that in turn affects mental health. So I would say a priority is to try to support everybody to get them back working. In my previous role, when I was a provider CEO, we hired various people over the age of 60, and they were always amazed that we were willing to take them on. They thought, nobody will have me. I've never done this before. And I think sometimes the sort of job board approach to advertising doesn't necessarily capture those people. They wouldn't necessarily be looking because they don't necessarily think that anyone would take them seriously. But I do think that, you know, the sort of advert in the local post office type approach does work quite well, and the word of mouth thing works quite well for that group.
So Deborah challenged us to hang around outside the school. So
well,
I think there's an awful lot of grandparents outside the school gates as well, but where else are you? Where else?
Well, Facebook groups, I suppose, is another one, because, you know, a surprising number. I mean, the younger people don't really go on Facebook anymore. but the other thing that we sort of skirted around today, but haven't really talked about very much, which ministers seem very keen on, is international recruitment, and I think that might be worth focusing on a bit. I mean, I think, you know, my views on that. I think it works quite well in particularly in care home settings if the fee rates are high enough. At scale in state funded home care, when you've got fee rates of £15.80 an hour or whatever, you're going to struggle to meet the requirements. But also, as you've mentioned, it's an international market. There are other countries that are doing better than we are when it comes to reducing complexity, reducing cost, and also looking after people well when they arrive. So I think if we want to make that a bit more of a thing, we've got to do better on all of those fronts.
Great. Well, and Deborah, you sort of encapsulated that, not a second class option, a first class choice. So these are not just about the professionalism of care, but also about the way in which care holds and nurtures and develops people. Yeah.
So I'll come on to that in a minute. I'm just going back to the point that George raised, and actually probably Jane has answered for me, but actually you don't need government policy. You can get on and do these things as an employer. You know, nothing's restricting you from you know, sitting down and being creative now. And you know, I always think that the people at the front line of our services often have the best solutions. It's just we never give them airtime and ask them. So I think there's something about talking to people, you know, kind of, you know, those best idea kind of competitions and that. So I think there's that. I had a vision then, Vic, of a kind of community bus driving around the street saying, you know, come and join us. There was that kind of slightly evangelical way. So I think there's that opportunity. And there was something else that's gone out of my head. It'll come back in a minute. But you know, I think there's just stuff that you can just be getting on and doing and being quite creative about now.
Well, amazingly, I seem to be target audience for all of this over 50s recruitment. I can't imagine why, but there's all sorts of new, I mean, we wouldn't be the first to think about it, because there's a whole new sort of set of employment services. Restless was the one that they keep sending me stuff about, which is all about kind of keeping people over 50s engaged. I would check, the challenge back would be that I've spent a lot of these roundtable discussions where everybody spends all their time saying, why don't any young people want to come and work in care? And I wonder whether if the majority of the workforce messaging was around, you're over 60, come and work in care, whether we would be worrying about that too. But Nadra.
Thank you. I noticed a question in the Q&A bit as well, but I was going to come in just to say that the elephant in the room always is going to be, especially when you look at younger people, is that pay scale. Is the reward, the remuneration, people want to be earning what they think is a fair wage, and we can't get away from talking about that in some ways. And I think there has to be a recognition that there needs to be a really open discussion about what that pay rate must be and how it's funded properly, so that we can create the career structures that we want. And whether, it doesn't matter whether it's 60 or whether you're 18 coming out, especially now at the moment with the cost of living, and we hope that we'll be coming out of that in a couple of years' time. But it does have an impact on the way people will be thinking right now about being able to pay their own bills and how they can do that. So I think we've got to also uncover some of that and unpack it.
Yeah, okay, absolutely. And sorry, thank you for drawing my attention to the question, and sorry, Martin, thank you for posing that, and we will come to it. So that the question, if you're happy to respond to it in your answers, is about, great for everyone to think care is a brilliant place to work, but if we don't have the money that talks about the pay terms and conditions and addresses pay terms and conditions properly, we're always going to be thinking about this. Now, clearly, we have a new Prime Minister, and we have seemingly a commitment around further funding to go into social care. So that may be something to look at. But in the absence of that clarity, Deborah, and certainly not putting you in a position to have to comment on that, but pay terms and conditions is something that's not just the challenge for care. It's the challenge across health and care. In a sense, and certainly it's very much the challenge when you come to thinking about competing on an international market. So thoughts about that would be great.
Yeah, I mean, you couldn't sit here and not say that of course you want people to be paid and remunerated appropriately for an incredibly skilled workforce. I'm not going to say anything other than that, because that's the right thing to do. And yeah, we've got a new government that's just arrived in a very strange circumstance of what's happened last week with the death of the Queen. So they're not exactly hitting the ground running. There's obviously things, but hopefully it'll give them time to reflect. I've got a meeting tomorrow with the Minister, with my first meeting. So we'll be talking about such things in my kind of briefing with him, so we'll see. So yeah, I absolutely agree, and I think again, I just wonder if some of it is that again, how we articulate the skills of this sector. I was out in the service, and Nadra was probably referring to something I said the other day. 2 carers supporting 2 young people with learning disability in a residential house, and this one individual, this one young man, he'd been brought up in foster care, and I was just, what struck me, and I know it's stating the obvious, but his total dependence on the skill and the advocacy of those carers, never mind the kind of the physical stuff that they do, but that absolute advocacy role that carers often kind of play in that. So absolutely vital that we recognise those skills and are remunerated. Obviously never mind the backdrop that we're living in at the moment with the cost of living, take that away, it still remains that people should be paid for the skills that they have. But I do think this narrative, and I think we all have a responsibility of talking about what is going on, what these skills are. I just don't think we articulate that enough.
Okay, Jane.
Yeah, I agree. Obviously, we need to improve overall pay terms and conditions, particularly in home care. They're very challenging often because care workers don't even get paid necessarily you know, the same amount for all of their working time. At least if you go into a care home, you're doing a whole shift and it's all a bit more certain, there's more security of income. But somebody said to me once that hotel managers used to be quite poorly paid, and it wasn't particularly seen as a professional sort of route to follow. But somewhere along the line that did change, and the money that you can earn has become really quite substantial if you do well, you know, so they've become more competitive roles. And I think we could think about registered managers, particularly in that kind of category. I can't think of almost a more difficult role. You know, you've got people, you've got the care regulations, you've got to do business development, you've got complicated, you know, negotiations with families at a time of real, you know, difficulty and sensitivity and stress for them. You know, the skill sets that registered managers have to have are massive. And as Deborah alluded to, you know, there are some parts of the sector that, you know, the private pay care homes who've recognised that. And some of those roles, you know, the base pay is like 70k, and then people can earn bonuses, you know, so you can then start to attract people in. Unfortunately, that isn't widespread at all, and I don't want to give the impression it is. But, you know, I think there are some parts of the sector which have recognised the complexity and difficulty, and also the fact that if you get the right people, it can transform everything, you know, your quality and your business performance. I want to just say something about New Zealand. Vic's heard me say this before, but they had a definite workforce strategy. They've still got one that they've been sort of working on for maybe 15 years, and they defined different levels of need in the population. So level 4 is the highest need, you know, people will say with dementias and frailty and complex health conditions, 4, 3, 2, 1. They then define sort of skills and competencies required to meet those needs, and put sort of training and qualification levels in at 4, 3, 2, 1. And then they sort of try to match the people who've got the right skills and competencies with the different levels of need. And then they kind of set like a national minimum wage each sort of level. So they recognize that when you've done either a certain number of years of experience or certain qualifications, your pay will go up. And they haven't got it, you know, perfect, and they don't claim that they have. But when if you look back before the pandemic has sort of changed things. But prior to the pandemic, the overall staff turnover in New Zealand went down from something like 35% nationally to 24%, and they encouraged an awful lot more young people into the workforce. And they actively, you know, their version of Skills for Care sort of went out actively into schools, talking about the career path, you know, the different types of careers. It isn't really right, like Deborah said, it's not really like a pathway as such. It's like the tube map that she talked about. You know, there's lots of different ways that you can come into it and different destinations, but they have sort of mapped out what kind of learning and experience you need for different things. And I think our government is trying to do that, I think, with this knowledge and skills framework that it's proposed. The big flaw in the plan here is that there is no means of currently of rewarding that increase in skill and competence. So how will we ever persuade anyone to take on a promotion? Yeah, you can say you've got all of these, you've reached your final destination, you've got all of these things, but actually you're not paid any more than you were when you started the journey. So that we do absolutely, you know, absolutely 100% need to address that somehow or other. Yeah.
Before we come to you, Deborah, I'm keen that we've talked a bit about kind of flexibility, different ways of working, some things that care providers might be able to manage themselves. You know, George out driving the community bus, rushing around, kind of picking up sort of people who might be interested in care, articulating the career in a very different way, thinking of those international models. I do want to come back to tech. I do want to kind of just see if we can begin to see where, and it'd be great, Deborah, for you to kind of comment on this, because health has had an absolutely massive transformation. And I think if you think about some areas which have transformed, particularly around surgical procedures and things like that 10 years ago maybe people would have said you couldn't possibly do that without a person, because it needs this element to it, this personal touch to it, this kind of expertise in it. But those have got, you know, that's a long forgotten conversation. Can you see that same thing happening in care? And if you were going to prioritize an area to look at, what would it be?
So yes, I can. I was just thinking of something flashed in my head. I wrote an editorial in a journal called Age and Aging about 15 years ago, I suspect, talking about technology. And the conclusion of which was this is really important, but you still need people. So I think there is something about a balance in the whole tech space. But I do think there's masses of untapped resource. I think the AI stuff is particularly interesting, and I just wonder again if there's something about, you know, sitting around, having been to an incredible session with Google once in a job I was doing, sitting down with some of those kind of, you know, brains size of a planet and just talking about where the potential is in terms of the social care space around that. So I think AI has got masses that time as we get better at you know, gathering information. It's about using information technologies, you know, that kind of data stuff. I think it's absolutely fascinating, and I'm by no means any techie, but how we use the information that we've got and how do we get better information to create different things. And you know, it's back to Jane's point about robotics. You know, there's stuff happening, you know, there's some of the best brains in the country in Oxford doing loads of stuff around robotics. Again, is there something of getting those brains around the table to talk about the potential of all these things? I think that we, you know, I think we need to be led by people who, you know, who can help us kind of carve out what the possibilities are. And you know, the stuff around, you know, you talk about toilets, you know, that there are things even now that you can go to the toilet and it'll give you a urinalysis. It can tell you what's happening in your wee. You know, there's all that kind, and there's some of that remote stuff that we've been doing around health for a long time and getting better at it. And I think there's more and more, and I think the possibilities are endless. But again, I think it's being led by some of those people about where the potential is. But amongst all of that, for me, is the human factor as well. You can't divorce that. It completely takes Jane's point about I'd rather be sitting at home and getting some support than not. And I agree with it. And I think, you know, probably stuff around medications, all that prompting stuff that is possible for people who have got memory problems and cognition problems. I think there's masses more we could be doing in that space too. So I think the potential for it is enormous. I just think we need to be much more focused about what we can do with that within social care, and we're not having those conversations in the way that we should.
And is that because nobody's interested, or is that because there's a sort of level of
I think it's because
about it, because it's almost like, you know, what is the thing you could say that the care workforce does that couldn't be automated?
Well, I think you know, that kind of that human contact, that reassurance, that kind of advocacy bit. I mean, you know, there is a need for that. But you know, it's back to Jane saying about all the stuff around the robotics, you know, exoskeletons and things that can help in terms of moving and lifting and handling. I mean, all of that stuff is kind of there in the background. And the reason we're not looking at it, I think, we've just got, you know, we've got the tail end of the pandemic and everybody's been distracted with survival. And maybe this is our time of a kind of, you know, even amongst the madness that we're facing for the kind of winter that's coming, that space that we now need to actually think of, as you say, we can't be having these conversations in another 5, 10, 15 years time. And this tech is changing every 18 months. So we're not even thinking about it, and it's changing every 18 months. So by the time we've thought about it, something new's come along. And that's why I think you need those brilliant brains around the table to tell us what our possibilities and our options are.
And do you think the brilliant brains would help, Nadra? I mean, do the brilliant brains understand what it's like to work in a very small home, small environment?
You mean the teching of it?
Yeah.
Well, I was trying to think, as you know, we're talking about this. I think it's a generational thing as well. I think I do feel that my generation, as I'm coming up that sort of age group, I'm more tech friendly. I don't know that the people that I see in care homes and SME care services, you know, I always go in thinking how many of these people could be looked after at home. So, and usually the answer is not many, it'd be 1 or 2 at most, and would tech be the answer? And they're not able to do so much with their tech. I think tech has a place, absolutely, as we go forward. Somebody with dementia, I mean, I think I'm not negative about it. I have real reservations around it. Somebody with dementia living at home, and I've seen this happen with Alexa, the panic that sets into their mind when something says it's time for you to take your meds, it's time for you to take your meds. That's quite a simple thing. And I know I'm saying this for effect more than anything else. We just have to think it through. So you have to introduce people into it and see the benefits of it for that individual. I don't think we can do a kind of blanket. Whereas with caring, I mean, even with caring, I was in a small home the other day where personal care was a challenge with somebody who had a bit of challenging behaviour. But personal care is the preference.
So what are you thinking of in that kind of, so where does that lead you to think that personal care is a challenge by people delivering personal care is a challenge?
Well, it can be a challenge, can't it? Because
but what does that do for us? I mean, is that about how difficult it is to perhaps get people to think positively about care?
I think there's a bit about the level of the care that we're delivering in those settings. And, you know, our home care colleagues are having this on an ongoing basis, aren't they? So the level of service we're providing is so different to what people's perception of social care is. Okay,
so there's a sort of there's a drift or a specific policy intent, whichever way you want to look at it, which has made care more complex, more and then you have the challenge perhaps of the environment doesn't catch up with the individual's needs.
I think it's that personalisation, Vic. I think it goes back to that no two people needing care or delivering care are the same. But how do you then
manage that in other personal settings, don't we? I mean, that's I guess that's the challenge, isn't it? We've still got George's million people that we need to get into the workforce. So how do we manage that in, you know, we probably would have said that about all sorts of things, diabetes management, all sorts of things over in previous time. Jane and then George.
Yes,
we're going to have to sum up, I think.
Yeah, so going back to what I said in the beginning, I think it's quite difficult sometimes for us to imagine technology making a big difference to what we're doing, because by the time people get to all of us in care services, their needs are already quite advanced. So I drew out what I call the pre-care people. So what we've really got to do is shift the demand curve. So, you know, the skills for care model is based on the assumption that nothing changes from what we're currently doing, but we can't really make that assumption because we know we're never going to get the people. So we've got to try to reduce the number of people that come knocking on the door of care in the first place. And I think, you know, one other barrier that we haven't really talked about is that the wider health and care system isn't currently configured to enable us to use those sort of tools. Because if you start monitoring everybody's wee in the toilet, like Deborah said, everyone's going to be like paranoid and they're all going to be knocking on the GP's door. You know, my wee's changed today, sort of thing, and they're going to get overwhelmed. So we'd need to have some other type of service, you know, or if everybody in the pre-care cohort, if you like, has got motion sensors in their homes and we can see that somebody's fallen, that's only useful if someone can go and pick them up. And at the moment, that isn't a universally accessible type of service. So, you know, sometimes having this technology could increase demand if we're not careful and smart about how we organize things. So I feel that that's quite an important area that we need to think about when we're sort of mapping things out for the future.
George.
Thanks, Vic. So I think from my perspective, I think reflecting upon what my three colleagues have said is that really there are new challenges, but also new opportunities. So I think, as we've heard, people are living longer and with a host of complex conditions or increasingly complex conditions. And the social care workforce needs to change to reflect this new reality. So it's essential to ensure that there are the right number of staff who are equipped with the right skills and have access to the latest technology to meet the needs of the people they support now, but also in the future. So this means increasing the number of people in the workforce, making sure the right people with the right behaviours and values are attracted to a career in social care. And I think with an increasing expectation and demand for personalization and integration, themes we've just discussed, we do require new ways of working and a more flexible workforce. And I think that's where I would leave it, Vic, from my perspective.
Great. Okay, thank you. Any last comments from anyone else? Were you happy for me to sum up? Okay. All right. Well, look, thank you, all four of you. That's been very valuable to hear your thoughts. The future of the care workforce, I mean, it is a conversation that we are having on a very regular basis, in a sense, and as Jane pointed to, you know, that future is under active discussion in the context of the reform programme. But, you know, again, as Jane mentioned, the reform programme doesn't pick up pay terms and conditions at the end of it, so it may give us a very clear kind of pathway and set of roles and maps that might help us with some of the things we want to do about articulating what care does, how it's changed, the levels of responsibility. But unless that's accompanied by commensurate review and implementation and support of the pay terms and conditions, that's going to be very challenging. But there are things that we could be doing now around flexibility, around recognising the kind of demographic shifts that are going on. So lots of things, and there's some great time-wise and a whole variety of different organisations out there who advocate and champion flexible working, and I've no doubt there's some great skills for care resources that sit within there. So there's things that organisations could actively be doing to kind of think about how they tap into other parts of the workforce that we haven't previously thought about or approached. But I would say that, you know, we're not going to be the first to think of that, and we are really actively going to be having to address how the UK care workforce it sits alongside the global pull around workforce, which is going to be something that we'll see, I think, escalate pretty significantly over the next 3 to 5 years, if not earlier. We're just about to see a care strategy, a European-wide care strategy, which will compete, in a sense, and with a UK based one. And I think we have to think very quickly and clearly about what makes the UK different as a kind of employer of choice in that sense. And I think, you know, we started to unpack some of the issues around AI, robotics and replacements for workforce. Again, this is not a new discussion, and I think, you know, Deborah's comment that, you know, we still need people at the end of it, or we do, but again, we need to do that really detailed articulation of what we need people to do and what we don't, and it won't be one answer and it won't be one way of doing it, but having the sort of choices and options that older people in Japan or other countries have around the sort of tech that maintains independence, which enables them to see and do and act more quickly in a preventative way than we have here currently, is probably part of an answer around that. And I think we, you know, when we think about, I just go back to that point about when we think about tech, I think we need to be thinking about what it can do for people, but also what it can do to minimize workforce requirements, and those will sit hand in hand, I think, as we go forward. So lots to do, but great to hear re-articulated again and again the kind of positivity about working in care. I thought your point, Deborah, as we head into winter, we may actually see people wanting to actively move into care from health. You know, let's be thinking about why and what is it that's attractive, and what is it that makes it the kind of autonomous, independent, you know, life-changing environment that it is. And let's shout that from the rooftops, because we need more people, and we need people with the passion, commitment and values that will ensure that great quality care is delivered now and for when Jane needs it in 30 years. Clearly I'll be many more years away from that, but when we all need it, because that's the point. And I think that ultimately that is the thing that we have got to get so much better at, is making sure, just like health, people realise that social care matters to all of us. It's not something you can pick or choose whether you need or want. It's something that we all need to have in place when we need it and where we need it. But thank you very much for joining the debate. Thank you for those of you listening for supporting Professional Care Workers Week and for your support for the Care Workers charity. It's hugely appreciated. Thanks. Goodbye.